Hello, my name is Shannon Harrod, and I am a Maryville Family Nurse Practitioner student. Today I will do my head-to-toe assessment. My patient is Michael Harrod, and before he came in the room, we had him change into a gown and empty his bladder. We also took his weight, his height, his vital signs. As he walked in, I noticed his gait. So we will start the assessment. Start by evaluating and inspecting his head. And his head is slightly rounded, normal cephalic. Let me know if you feel any tenderness. I'm going to palpate for any indentions or lesions, and there are none. I'm not even on the camera. There are none noted, no tenderness noted. I'm going to check the scalp, and it is freely moving. The hair follicles are firm. The hair is clean with no nits or skilling. There is no alopecia noted, and the hair is symmetrically displaced. Next, I'm going to move to the facial bones. And I'm going to start with inspection, and there is no deformity of the bone structure noted. The eyes, ears are symmetrical. His nose is midline. I'm going to palpate. Let me know if you have any tenderness, starting with the facial sinuses and then the maxillary sinuses. And there is no tenderness noted. Now I'm going to test some cranial nerves. The first thing I want you to do, we're going to test cranial nerves 5 and 7. So I want you to make some faces for me. Wrinkle your forehead. Smile. Stick out your tongue. Clench your teeth. Puff your lips. Your cheeks, rather. Okay. Purse your lips and blow. All right. And all that was in normal, so those cranial nerves are intact. Next, we will check cranial nerve 5 by testing his sensory. So I'm going to get you to close your eyes, and you let me know where you feel it and if it's the same, okay?
All right. Top of the left.
Forehead.
Cheek.
Same?
Left cheek, yeah. Same. Forehead. Chin. Chin.
Same?
Yeah.
Still the same? Okay. So those nerves are intact. Next, we'll look at the eyes. His eyebrows are symmetrical and extend through the canvas. Look at me. His eyelids are appropriate. Close your eyes. Palpate. There is no edema or ptosis. Open. I'm also going to palpate his lacrimal glands, and there is no tearing or crustation. Now we'll check your cranial nerves 3, 4, and 6 by doing some eye tests. And I did fail to mention that prior to entering the room, we did check his vision. We did a distance vision check using the Snellen chart, and we did a near vision test using the Roseberg chart. And so now we will check to see indirect and central. The pupils react, and it constricted, and now concentral. Okay. Indirect. both responded appropriately. His conjuncti is pink and moist. His sclera is white. His eyelashes are curved away from the globe. Now we will, I'm going to get you to look at a picture behind the wall, and then go ahead and pick a spot, and then look at my finger, and we're looking for, okay, we're looking for constriction. Now we're going to check, I want you to follow my pen light, and do not move your head. Okay, and I don't see any extraocular movement. Now we'll do the cover test. Okay, and take that hand out. And then the other eye. And again, there was no extra ocular movement or strabismus. Okay, so that was good. So those cranial nerves 3, 4, and 6 are intact. I know his cranial nerve 1 is intact because he has a great sense of smell. He smelled my perfume when we entered the room. So next, I'll check cranial nerve 11, and I'll get you to shrug against me. Okay, and that shows that cranial nerve 11 is intact. Now let's do some motions with your tongue. Stick your tongue, there you got it, and there's no tremors. Now put your tongue, go to your nose, like, into your chin, and then inside your mouth, push against my hands on, okay, and okay. And I'm also going to go ahead and check his TMJ joint, open, all right, and move your side to side, and that is without popping. And then clench your teeth. I'm going to go ahead and check for symmetrical muscle, and that is there also. All right, now we check the cranial nerves. We will move to his ears. And I'm just going to inspect the ears. And the skin on the ears is the same color as his face. There are no lesions or masses. Now I'm going to palpate his ear for tenderness, any tenderness. And then we'll do the same on this side. Again, the skin is the same color. I see no lesions or masses. Any tenderness? So we will look at the tympanic membrane by pulling up and out. And the tympanic membrane is pearly gray. I'm sorry, am I hurting you? Pearly gray with a light reflex. I do see the bony prominences. And there is a slight amount of cerumen present. And again, the same, up and out. Pearly gray with the light reflex. And there is no cerumen in that ear. Okay, so now we'll do a hearing test. I'll get you to cover one ear at a time, and I'm going to whisper. Okay, and change ears.
Orange.
All right. So we know that the cranial nerve 8 is intact for hearing. We'll do the Weber test now. Let me know if you hear it equally in both ears.
Yeah.
Okay. And now the Ryan test. Let me know when you don't hear it anymore.
All right.
And again.
All right.
Okay, so we know that air conduction is better than the sound conduction.
All right. All right.
Okay, so cranial cranial nerve 8. Next, we'll move to checking his eyes. Well, you did your eyes, didn't you? Yes. Eyes, ears. So we'll move to his nose. And again, we're just going to inspect. His nose is midline. The skin there on his nose is the same color with his face, tan. There are no masses or indentations. There was no tenderness. So now we're going to look at his nares. And they are both patent. I'm going to get you to cover one finger over one nose and breathe in and out, and the other. Okay, so both nares are patent. There was no flaring. I'm going to get you to lean your head slightly back. And the mucosa is glistening pink. The turbinates are not swollen. The septum is without any holes or bloody crustaceans. So next we will move to his mouth, and I'm going to inspect his lips. They are without drying or cracking, no lesions. They're pink and moist. We get you to open your mouth, and I am just looking at your tongue. Let you stick it out for me. It is well papulated. Get you to raise it up. His frenulum is present. The dorsal side is smooth. Looking for skin cancers. I see nothing. No lesions. Now we're going to check the buccal mucosa in the mouth. Just looking at your cheeks. And they are without lesion and pink and moist. Reddened colored. Now say ah. Uvula is midline. My patient has a very sensitive gag reflex, so cranial nerve 12 is intact. I'm going to get you to stick your tongue way out. Okay. Again, the uvula is midline. The pharynx is glistening pink, smooth. Hard palate is intact, along with the soft palate continuously. My patient does not have tonsils, but he does have pillars without infection, signs of infection or swelling, no lesions, and there is no mouth odor present. Check your teeth. Patient open up, has 32 white teeth. There is that a filling? No. One filling present. Gums are tight around teeth. Next, we'll look at the patient's neck, and it is the musculature is symmetrical. I notice no jugular vein distension, or the carotid vein is not protruding. We will get the patient to do some range of motion. So I'm going to get you to put your chin to your chest and lean your head back, and then ear to each shoulder, and this side. Okay? And we did that without any discomfort. Now I'm going to get you to push your head against me, and then back, and then try to push your head against my hand, and this side. All right? And of course, no problems with that. Now we will examine the neck, and the trachea is midline without tugging. We feel the carotids. One at a time. they are regular rate rhythm. Check swallow. Thyroid is without border and smooth. Now I will also take the carotid and the thyroid with my bell. No brewery heard there, and no brewery heard there. Okay. Also no thrill brewery there. Next, I will feel for his lymph nodes. So we'll start paddling your head back a little bit. Occipital, post-ocular, I'm sorry, yeah, ocular, preocular, tonsillar. You put your head down, just like normal. Submandibular, submental, superficial cervical, cervical, curling your head this way, deep cervical, supraclavicular, infraclavicular, and then axillary. This side also. Okay, and I do not feel any of those nodes present. So now I'm going to get him to turn around a little bit and just face that way. And we'll inspect your back, do your back. And his back, his skin, he has some freckles and moles. The hair distribution is symmetrical. I see no lesions or bony structural deformities, no scoliosis. And we'll double check that again. So now I'm going to palpate. Let me know if you feel anything tender. All right. I'm going to percuss the costal region. I'm going to check. There's no barrel chest. He's not barrel chested. The diameter is within normal reason. Now I want you to take a deep breath in and blow it out. Diaphragmatic excursion is our good chest expansion, and it was symmetrical. Of course, our respirations are not labored. So now I will oscillate. Deep breath in with my diaphragm. Again. Okay. Good air movement, no rock eye, rails, tenderness?
No.
Okay. And now I will percuss for the diaphragmatic area. Alright, so we'll mark there. Alright, and that is about 3.5 to 4 centimeters, so that is within normal. What else am I forgetting on your back? I think that is also when you turn around and move to your chest, let you turn back around, and go ahead and take your gown off. And I'm going to examine your upper extremities, and they cut me off. Equal muscle mass, they're warm and dry, good skin color, no edema or bruising noted. Nail beds are smooth, capillary refill is less than 3 seconds. Nail beds are firm. We'll check for your radial pulse. +2. Your brachial. Okay, on this side, radial. And your brachial. Okay, they are all even. Go ahead and check for strength. And I'm going to let you push against my hands. Okay, and then push up. Alright. And push, try to push in. And then out. Alright. Seems to be equal. Now we'll move to your chest. And I'm just inspecting. I see no abnormal bone structure. Hair pattern is symmetrical. So I will palpate, check for firmitus, say 99.
99. 99. 99.
That is equal, and you know what? I did not check for that on your back. So we'll go back and do that now.
99. 99. 99. 99.
Okay. And that was all equal. So next on your chest, I will auscultate. Listen for breath sounds. Good deep breath. Okay. Good. Again, I hear good equal air movement, no rhonchi or rills. So next we'll move to the cardiac. And I am going to feel your pericardium. And I feel no heave. And your left. And for your umbilical pulse. Okay. And now I will listen. This is your thoracic. tricuspid, mitral valve. Then I'm going to listen with my bell. Again, thoracic.
Uh-oh. What is that? Advertisement?
Oops, sorry. Accidentally hit something. Thoracic. Listen for a murmur. Pulmonic. Herbs point. Tricuspid. And mitral valve. And all that sounds normal. So next we will move to the abdomen. I'm going to let you lay down.
Turn the camera down.
And I am going to shine the light across his abdomen. And I do not see anything that is abnormal. I'm going to look and make sure I see no pulsations or distensions, and I do not see any at this point. So I'm going to auscultate for vowel sounds. Using my diaphragm, I'm going to do the right upper quadrant. Left upper. Right lower. And left lower. And I'm going to wait up to 5 minutes. If I did not hear them. Now I'm going to do light palpitation. Let me know if you feel any tenderness. No? And then deeper palpitation. Okay. The belly button, umbilicus is midline and inverted. Again, his hair pattern is symmetrically distributed. Now I'm going to listen for his arteries, thoracic artery, using my diaphragm. And his renal arteries. Iliac arteries. And his femoral artery. Okay. Hit it. What? let's see, I need to do your liver, feel for your liver, to get you to, I'm going to percuss, whenever percuss, so you can tell the difference when I'm over in Oregon. It goes from tympani to dull. And now we're going to check your liver orders. Okay, here's your mark. We're going to go back up. And they are about 4 inches, so that's within normal. I'm going to get you to take a big deep breath in and hold it. Exhale and hold it. Okay, I do not feel your liver. You can breathe. And then we're going to do it again, and I'm going to feel for your spleen and then your kidney. It's probably going to be hard for you to see. Sorry. Deep breath in and exhale. Exhale. And hold it. Okay. And of course, I do not feel the spleen. It is not enlarged. Breathe, and then we'll do it one more time. Take a few breaths, and I'll see if I can palpate your liver. Your kidney, I'm sorry. Okay, deep breath in, exhale, and hold it. And I am not able to feel it at this time. All right. So now I will let you get back in the chair. And we will examine your lower extremities. And again, we're inspecting, and there is equal musculature and hair patterns symmetrically. Skin is warm and dry. There is no edema. Nails are smooth. Capillary refill less than 3 seconds. Nail beds are firm. We will check for pulses. Bend your knee a little bit. Good for the popliteal. Okay. So regular. Your posterior pedal. Minus +2. Regular. And your tibial. Alright. Minus +2. Check this out. Alright. +2 irregular. Popliteal is equal to the other. +2 irregular. And your posterior. Alright. Now we'll check some reflexes. So you just let your legs hang. We're going to check your knee reflex. And this one. Alright, good. Hope you can do this one again. Good. Now we're going to do your Achilles. And there's usually just a tiny reflex there. Okay. And now we'll check your appropriate response to all his reflexes. You check your muscle strength, your reflexes, your arteries. I believe this concludes our exam, although I must admit I did forget to check his red reflexes, and so I will go back at this time and do that, but my preceptor was nice enough to let me borrow her ophthalmoscope, so, alright, and it's present in that left eye and in the right eye. So this concludes my head-to-toe video. Thank you for watching. Dang, it's over, but it's supposed to be, it's only supposed to be 30 minutes.